Let's try and understand what the landscape is looking like. Dr. Velumani joins us on the show right now to talk about exactly this. Dr. Velumani, thank you so much for taking the time out and firstly wishing you good health and prosperity in the year ahead. Good wishes from all of us.
Thank you very much, and wish the entire team and the 18 audience a wonderful year 2025.
Thank you so much.
Go
And
ahead. I read that, and a lot of enthusiasm. I'm sure is for quick commerce companies. I think we were surprised to see groceries fast. Okay, then fashion fast. Okay, they are not needed fast. But then we are hearing medicines fast. It's very much needed. And now I'm understanding ambulance fast. I think fashion can wait for months. Groceries can wait for weeks. Medicines can wait for hours. But I think ambulance is needed in minutes. So I have a reason to believe that this, if they can optimize and standardize, there is a likelihood it will completely change the way in which the either terminal healthcare or the accident trauma related healthcare will be totally different. This is my opinion.
I understand the intent is noble and the need is there, but what about the actual execution? Because this is not the first time anyone is attempting that. It's just the lack of infrastructure and other facilities that have made difficult ambulance services or emergency services being possible in 10 minutes. Have things changed, or what more is needed, you believe?
Today, Amazon is giving door delivery for services across the country, which was not existing 20 years back. I, as a laboratory businessman, I started home service as early as 1999. Those days, we started with pager as the technology. Then, when we saw mobile as a technology, that means the mobile phones, we started delivering home service. I think we were very successful in delivering in Mumbai. Then we extended to other major metros. Then finally, when I exited in year 2020, there were 90% of my patients serviced at home. So it took 25 years to optimize, to standardize. I am of that opinion, even ambulance services will have to get optimized. I think today the ambulances are more standing, less used. Every hospital has their own ego. They park their ambulances. I am of that opinion. If done properly, same number of ambulances which are now there in the market can mobilize not less than 10 times more patients. This is my personal calculation.
Velumani, always a pleasure to connect with you. Nikunj also joining in. Mr. Velumani, now this entire healthcare angle, and especially the ambulance service, Mr. Velumani, has this whole, servicing which is being done by trusts, NGOs, by charities. Those ambulances are also playing a critical part in the way how the emergency services are taken care of. Now, Blinkit would be a profit to made kind of an ambulance service. But let's be clear here, sir. The ambulance service in India, emergency service in India is also subsidized by a lot of good men like you who give it back to the society by giving free ambulances, and which are run by trusts and then by foundations.
Now, let me, I know what the myth is that these hospitals who have ambulances are interested in the common man. I am not agreeing with that. Every hospital has an ambulance and they don't take a patient to any other nearby hospital. They will take to only to their hospital. And I don't know how this ambulance market is running. It's a mafia. They stand in highways and the minute they get a opportunity, they take it to that hospital, which will pay them the most. Very sad to tell this in the media, but I have experienced some of them in my last 10 years of journey. So I am of that opinion. If a stakeholder has his own ambulance, it has a bias where it should go and how the patient should be handled. I think a neutral agency which has no healthcare stake in it, no bias in it, will optimize it. I am pretty sure in a 5 years period, either Blinkit or some more Blinkits would come. And this industry needs a really solution. The 1 hour after a trauma, after a cardiac arrest, after any emergency is very, very vital, and getting the patient to the doctor's table is very important. I think it will be supported by AI, supported by every possible intelligence to reach to the closest doctor, not the driver who decides where to take.
Now I'll move to the other part, which is what Blinkit has announced versus what we've got from Big Basket. Delivery of medicines in just 10 minutes. This is great. I mean, it gives you medicine in 10 minutes, but the medicine market in India, and I'm talking about the retail market in India, is serviced by the unorganized sector. And perhaps all large localities have, if not 3, but at least 2 small shops of medical where you make a call, send a WhatsApp, 10 minutes mein medicine aa jata hai. Is there merit in thinking on those lines that you can make medicine, both prescription and OTC drugs, available in 10 minutes? Is there merit in this thought?
There are 2 kinds in medicine when you analyze the need wise. One is a chronic illness, another is an acute illness. In acute illness, you need it in less than an hour, if possible less than 3-5 hours. But in chronic care, I don't think you need it even very urgently. It can be well planned. But having said that, market will not know, customer will not know, the delivery boys will not know whether it is acute care or it is a chronic care. But anything delivered faster as a huge market. I never expected groceries and fashion will have such a approval from the society that people have started consuming it. But I have a reason to believe medicine as well as ambulance all will redefine healthcare, and all current monopolies and what you call as advantages of early bird all will get somewhere neutralized, because when it comes, the technology comes into picture, newer guys have more to gain than the what you call as legacy guys.
What about the market dynamics of valuation? I mean, today quick commerce is the toast of the town. Zomato has tasted success because the Blinkit has taken the market cap of Zomato to 3 lakh crore. It is a Sensex 30 company. Somewhere, do you think that whatever quick commerce companies are attempting, it's good, but it is more targeted towards getting the mind space and market share and getting the market cap right?
I think market cap is a very big misnomer in terms of success of business, which we know for the last couple of years. Somebody who went to 10 billion suddenly see themselves less than $1 billion. There are many such companies. But coming to what would really matter is how efficiently you deliver the service, what is cost of delivering the service, and what is the revenue by delivering that service. These would get optimized only when the scale comes. Until the scale comes, it won't be making sense. But if this kind of announcement certainly will create a lot of anxiety, lot of expectations by investors as well as all the stakeholders. But वो ही जीतेगा जिसका पास ताकत है, and that business model will win which has been logically made, and that balance sheet will prosper which has optimized the cost intelligently.
Do you see something like this coming in the diagnostic space also? 10 minutes may get a blood test done?
No, actually, this was the reason why I exited the business. There were obscene mails mails which are abusing mails rather, telling that if I can get delivered by Swiggy in half an hour, what nonsense you are giving an appointment after 2 days. Is that not health more important than food? Now, I don't want to argue that health is not important, but I need a qualified technician. Blood can be only collected between 7 a.m. to 10 a.m. It can't be collected entire day. I need to position and I need to optimize. Everything is needed. So I am of that opinion. Jepto or Blinkit might be very successful in fashion or food or grocery. But when it comes to medicine and ambulance, it is not going to be that simple to get it in right place. A lot of experimentation needs to go. And I am sure I have seen how technology has been evolving, how logistics has been evolving, how people can use a man in the morning for collection for blood, evening to deliver the food. Even many of my collection boys were delivering food in the evening. I think it's a prosperity even for the field staff. They can start working from 7 a.m. to 11 p.m. means it's a huge prosperity for everyone.
I'll wrap it up with one more question on diagnostic stocks. When we spoke to you last time, you were of the view that, look, the competition has gone, pricing discipline will come back, and the sector will go back to growth of 15 to 18%. So pricing intensity is out now, growth is 15 to 18%. What would be the next big trend in the diagnostic space for next 2 or 3 years, which you think could impact valuations as well as profitability for the listed players?
I think year 22, 23, both years were the worst years for diagnostic industry because the turnovers have nosedived, the profits have nosedived post-COVID. But I think if you keep the base as 2023, mid 2023, from there till now it is 24 is over and we are in the beginning of 25, 24 last quarter rather. I think it has done well. All the stocks have done fairly well, I would say, for that base. But would they reach to the market cap of 2021, mid 2021? Yes, they would. Maybe it will take another 2 years, 3 years, and for some of the companies, it may take even 10 years. But having said that, in the diagnostic industry, the conventional pathology tests which we are running for the last 25 years have lost in their ability to support the balance sheet because everyone has started doing it. Something new have to come. Vitamin D came in 2010 and it sustained the growth for almost 10 years. And then COVID, very, very temporary, it vanished. Today, I am expecting genomics, that's the sequencing work, that is the genetic studies used in prediction and diagnosis and even guidelines for treatment is likely to take the top line growth far better. I have a reason to believe currently it is only around 5% is the revenue in the balance sheets of big players for molecular diagnostics. When I talk molecular, the molecular that uses sequencing as a method for identifying the illness as well as the resistance to drugs. I believe by year 2030, that's in another 5 years, this 5% could be 15 to 20% is my feeling, because you don't have much other to explore. So people will have no option and explore this. And believe me, it has huge potentials.
Okay.
Right, Mr. Velumani, so good to have you on the show. Thank you for taking
Thank
the
you very
time out
much.
and speaking with us today.